I'm Ryan Sundermann. I'm the Emergency Department Director for St. Luke's Emergency Department. I've been doing it for about 15 years, and I've been in the department for probably 16 years, and I've been a physician for over 20. What we don't want to do is find out that we didn't take enough action early on so that hospitalizations spike. And one of the big problems with that is hospitalizations typically lag behind about 3 or 4 weeks, and so we won't know how severe it is in the United States for probably another 2 to 3 weeks, since it's just really taken off in the last 1 to 2 weeks. So we don't want to find out too late that we didn't do enough and we're already hurting for hospital beds. And so if it gets worse, that's going to be a pretty big problem.
Because we're still dealing with folks that we know are probably in the hospital now.
Yeah.
They have the Delta variant.
Probably,
right?
yeah. I mean, it's crossing over, but yeah, probably Delta.
And we're very busy right now.
Very
busy.
busy.
I guess talk about what you're seeing in the ER and
Sure.
in terms of people coming in and seeking treatment.
Sure, and the doctors here at St. Luke's in the emergency department, we work at a couple of other smaller hospitals, Jones Regional, Independence, and so we cover those emergency departments. And so we've kind of seen the whole scope of what it's like to take care of patients right now. And what we've seen is that as the hospital fills, it's much harder for us to take care of patients because there are no hospital beds available, not just for patients that are sick with COVID, but for patients that come in with other things, for example. And so they've had to cancel elective surgeries a few times, and they've really had to kind of make a bunch of changes. And that's very frustrating for somebody who's been waiting a long time for their hip replacement. They find out, I can't get it because 80% of our medical beds are occupied by COVID patients. The problem with it is that the average length of stay for a patient that has any other general illness is about 4 days. If you come into the hospital, you can plan on staying 2, 3, 4 days. For our COVID patients, it's about 8 days. So not only are there a lot more COVID patients, but they're sicker longer at like 8 days, and so we just can't get them out once they get here. And then what happens is it backs up in the hospital, it backs up the OR, it backs up the ER, and then what happens is in the smaller hospitals, as we've found when we work there, it becomes extremely difficult to find a place to send them if they are ill. A lot of these smaller hospitals, they can handle most of the general run-of-the-mill stuff, coughs, colds, pneumonias, even some minor hospitalizations. But for anything that requires a specialist, they generally have to get transferred. But when these bigger hospitals like St. Luke's are full, they can't accept transfers, and that becomes a big problem, especially for states like Iowa, where we have kind of a limited choice on these hospitals, on bigger hospitals. And so if you're in one of these smaller hospitals and you're ill and you need a specialist or you need a surgery, getting transferred to a bigger hospital suddenly is a very big problem. And you can wait hours, days, and we've had cases where people sit and we've got to do everything we can to help our providers in those smaller hospitals manage these very, very sick patients. And that's not ideal care. So.
Yeah, definitely not the care that we really are used to providing, that we all kind of expect, I guess, in our community.
Yeah, I need my gallbladder out, send me to St. Luke's. They'll take it out. They're happy to take it out, right? And so those are not even elective surgeries. Those are emergency surgeries. Elective surgeries, okay, we make a sacrifice because we're trying to get through this. But emergency surgeries, if I need to have my gallbladder out, I can't wait, But there are cases where they've had to wait, and that becomes dangerous for the general public.
Let's talk about our team members. I mean, physicians like yourself, nurses, surgical techs, all the healthcare workers that the hospitals run, really just have been working so hard for almost 2 years now. Let's talk about what that looks like. I know there have been folks that have probably retired early.
It almost gets me a little bit choked up because I've seen a lot of people exit early because they're just burned out because it is so hard, and this is a busy time of the year usually because we have all the other cold viruses, things like that, and then you throw COVID on top of it, and so like the routine stuff that we're used to, at least we can get patients the care they need, and now we can't. And then the frustration of patients coming in, they have a lot of misinformation about the vaccine, they haven't gotten the vaccine, and I understand that. I really do. I get why people were scared of it, but now we know it's safe, and so it's I'm sure it's frustrating for patients who haven't been vaccinated to hear, why didn't you get the vaccine? And I get that, but I also see what's happening because we aren't getting the vaccine, and I see the burnout in my peers where they say, geez, if we could have stopped this so much earlier. We could have really stopped this earlier, or at least slowed it way, way down, and we missed that opportunity. And it's still there. We still have an opportunity, but it's burning people out. They're just too busy. They see increased people with death. Their own family members are dying from this or getting really sick from it.
Now, you hear probably lots of myths, facts, alternative facts, as it were, from folks in the ER as an ER doctor. What are some of the ones that stick out that you hear the most that just frustrate you?
Yeah, I think a lot of them are that, some of the ones that they're going to track you with it and things like that. They're silly, but I get it. People don't know which information source right now. Picking a reliable news channel, people have no faith either side of the aisle, and I get that as well. I mean, conspiracy theories abound. But here's the thing this is an old technology. It's been around since the mid-'70s. There are guys fighting to get credit for who kind of came up with it back in the 70s and 80s. The biggest problem was there wasn't a huge need. They were fighting about they were working on other therapies, and they had a hard time stabilizing this type of vaccine. It would fall apart before they could get it into your arm is kind of the thing. But then when this came about, they had a ton of money pumped into it, and they learned how to stabilize it. This vaccine is simple. It's a little fat coat. It's called a lipid envelope with a little set of instructions. People worry about the biggest thing is they think it gets into your DNA. It comes nowhere close to your DNA. You can watch great YouTubes that will take 2 or 3 minutes to watch, and it explains them eloquently, simply, so that literally you could teach it to your 8 or 10-year-old. But they basically get into your cell, not your DNA. Your DNA is in your cell, but it's in a separate compartment. And then it's just a set of instructions. Your body makes that protein that looks looks like a piece of the COVID virus. Your body makes a whole bunch of antibodies against it, which are the things that fight off a virus. Then those things are circulating around, and then over time, unfortunately, and then if you get infected, then that fights off the virus. But like with all vaccines, that immunization wanes over time. It goes away because it's supposed to. You don't want that sticking around forever. Your body quits making those proteins. But it's not in your DNA. It's not there. It's not something that's permanently there that can change who you are forever. That is the biggest myth that's out there. There's a lot of other myths about does it affect my pregnancy, or does it put me at higher risk? And the thing is, you are at so much higher risk from getting COVID if you are pregnant or immediately after pregnancy when your immunity is already suppressed. When you're pregnant, your immunity is very suppressed because you have a baby growing in you and your body doesn't want to reject the baby. So if you get sick with COVID while you're pregnant and you get into that really sick phase, which is this inflammatory storm, your chance of losing that baby is huge. So for new mothers or wannabe mothers, that's critical for them. For older folks, this is one of the things that's really going to put you at much lower risk. And for the general population, the thing is, if you think that your average immunity, that people think that I had it once, or I think I had it, or I was sick one time and I think I had it and my immunity is better. Your immunity, if you get sick and you're immune to it, that's fantastic. It's a great immunity for about 3, 6, maybe 9 months. But this virus is changing rapidly over months now. And so the thing is, your immunity wanes and it changes because the virus is trying to outsmart your immunity. So the thing is, if you were sick, that affords you some protection. I had COVID. The fact that I know that I had COVID and I got 2 vaccines and I got a booster, that's the best protection of all. Now, I don't want to advocate for people going out and getting COVID, but the thing is it does provide protection, but it is not like it's like some panacea and it cures everything. You got to have the vaccine and you got to have the booster right now. The vaccines with Omicron provide about a 30% reduction in symptoms. With the booster, it's about an 80% reduction. And so the thing is that it's critical. If you don't want to get sick from the virus, you got to get the booster. If you haven't had any of them, you got to get the vaccine. That's going to give you a great reduction in symptoms. And most importantly, hospitalization. If you get sick from it, okay, I get it. Isolate, keep yourself safe, but your chance of hospitalization is way less. And it's not going to make you sick. Nobody's tracking you. It's not in your DNA. It's going to save your life. And it's simple, and it's going to change medicine. Here's the most important thing one of the most important things of the long-lasting effects. This science is going to change medicine. It's going to help us cure cancer. It's going to help us cure HIV. It's going to help diabetics make their own insulin. It's going to be incredible once we capitalize on this technology because they didn't have it figured out quite all the way. Now they do. Now it's stable even at room temperature for some of them. So it's going to really change the way we practice medicine. So get your vaccines.
And speaking of changing medicine, the new treatment. So we have the antibody treatment.
Yeah.
And then just today it was announced that Pfizer's new at-home prescription will maybe be available soon.
Yeah,
what do you know about that?
It's going to be available. It's going to be really limited numbers. They got to focus on the vaccines because prevention is so much more important than treatment. So all the money is in prevention. And everybody, I know they think, well, give me that pill. Well, if you're okay with a pill, you should be okay with your vaccine, because the vaccine's actually way simpler than the pill that they're coming out with. It's an antiviral pill. You've maybe heard of Tamiflu that they use for influenza, kind of the same idea. And so the thing is, it is in the initial study, and things change, because the companies are always going to put out their best data. So the thing is that right now it looks like it's a huge reduction in symptoms. It's a massive decrease in hospitalizations. But unless you're really high risk, either because of age or pre-existing condition, you're not going to be eligible for it, because they're just not going to have enough of it. So if you don't want to get it, don't count on it, because we are giving the monoclonal antibody infusions, which are, so the new pill's an antiviral. This is an antibody infusion that directly attacks the virus, as opposed to the pill stops it from kind of replicating. They work a little differently. But the infusions, they were helping, and like some of the older ones quit working as the virus mutated. The virus does a really good job of staying ahead of us, right? Because it wants to survive. And so with the Omicron, the current antibody does have some efficacy, but again, it's not magic. There's plenty of patients that have come in after getting the antibody infusion saying, oh, I did the right thing. And then they come in, then they have to get hospitalized, because it's not perfect. It just isn't. And so the thing is that, if you haven't had the vaccine and you come in and you want the antibody, I get it, but they're equally new, so you should have just as little fear about one as the other. And we got to depoliticize this thing. And trust me, I'm a kid from 10 blocks up the street. I grew up here. I'm from here. There's a lot of, I would never lead anybody in this community astray, because I want everybody to get better, and I want my life to go back to normal, because it's tough on all of us. And I would love to walk into your room without wearing a mask and smile at you and say, hey, I'm Ryan Sundermann. Maybe I got a lot more wrinkles than I used to when I first started this job, but I still really enjoy that face-to-face interaction, and it's gone, and it's become less personal. So you got to say a lot with your eyes anymore. So
you do. One thing that is top of mind for all of us is the holidays are upon us.
Sure.
Is it safe to gather with our family?
Yeah, if you're immunized and boosted. If you're not, just this week, the rate of change, friends of mine that own businesses, they've seen their whole workforce start to get, a lot of them are young, and so they just have to go home with COVID, but they can't keep their businesses running. Maybe it's good, maybe it's bad that it's a holiday, because a lot of places shut down. Maybe that'll slow the spread, or they're not going to be open anyway, but it's not going away in a week, so it's going to really take off. So, but when you're getting together with your family, if you're immunized and you're boosted and you're not having symptoms. Now, if you're having symptoms, you need to isolate, you need to get a test. The rapid tests are okay, they're not perfect though. The PCRs aren't even perfect, but they're way better. But it's at least some reassurance, So if you want to get together and everybody probably the best thing you do, if everybody's vaccinated, everybody's boosted, and you all want to do an antigen test that you buy at one of the convenience stores, and it's all negative, you can feel pretty secure that you're going into a safe environment. Because if somebody has it, they're probably right at the beginning, they're testing negative, they're minimally or asymptomatic, the chance of you getting it from them is very small. Hopefully that's not the scenario, and hopefully everybody doesn't have it. But so you can probably reliably get together in smaller groups. Big groups where you can't be 100% sure what's going on, that's a little tougher. But going out in public, every chance that I got earlier to they said, okay, no mask at Hy-Vee or no mask at the grocery store. It's oh, thank God I don't have to wear my mask. Nobody's really saying a lot in that regard. Here's my N95. I don't go anywhere without it. And surgical masks are fine. Cloth masks, not ideal. Ideal is surgical mask. But if you can get an N95 or even the KN95s, those are pretty good. They're not as good as N95s. I don't want Omicron. I had the other variants, and I don't want it again, and I'm doing my part, and so I'm wearing my N95. I don't think there needs to be a rush on N95s or anything like that. It's just I have an essential job, and I need to be here, and I can't afford to take 10 days off again, right? And so I want to be able to be here. But if I'm out, I'm wearing a mask, and sometimes it's uncomfortable. I walk into one store, everybody's got a mask on. I walk into another store, nobody's got a mask on. But last week, I wasn't wearing a mask. This week, I'm wearing a mask. And I hate to, but I'm a human like everybody else, I don't want to wear them, but I'm gonna, because I got to do my part, and I got to protect myself. I got to protect my family. So I got to protect my work, my peers at work. So, yeah.
Finally, and you kind of hit upon it with your plea to wear a mask, but kind of what do you want? What are the takeaways you want folks to know that may be watching this and still with us?
Yeah. We can get through this. I don't want to sound like I'm on the soapbox, but we can get through this, and we got to get through this, because it's wearing people out, and in the community, your neighbors, but here at work, if it gets worse, it has the potential to break the healthcare system, which is not just a bad thing for COVID patients, it's a bad thing for everybody with all the other things that they suffer from on a day-to-day basis. And so when it's your mom, and a lot of younger people don't want to get the vaccine because they think, it's my body, it's my choice, I don't want to do it. But in this case, you're right, it is your body. But, and you know, maybe if you're like, hey, yeah, my neighbor can get the vaccine if they want. But the thing is you, even if you are vaccinated, you can still get it. Again, if you're at much higher risk if you're unvaccinated, but if it's your mom, and we've seen kids get hospitalized with this, babies. So we're seeing that the age is shifting, and that's the natural progression of viruses. It gets the older folks first, it softens a little bit, but it targets the middle group. It's a much bigger group, so we see a lot of hospitalizations in the middle group, and it attacks the little ones. And so the thing is yes, it's important that you protect yourself, you make your own choices, but you do have an obligation to help your neighbor, protect the public at large. You're not in this alone. You're not living on a desert island. We're living in a community, and I want to feel like I'm part of a community. So it's patriotic. It's the right thing to do. And if the message was, if it goes out there like that, like this is what you need to do to save yourself, save your friends, save your peers, save your grandma, save your neighbor. You know, that's the way people should look at this. It's saving us all. It's getting us through it so we can flourish as a nation again. And if anything is apolitical as possible, it's that. Let us get back to normal. We can fight about all the other stuff once we get back to normal, but we got to get through this first. And that is the right thing to do regardless of what you believe in. So.